Okay, so that completed our list of words dealing with the combining form pulmono for lungs. So let's give you another one. Since you have one, let's have more. So pneumono is a combining form that means lung also, as in pneumonopathy, which would be a disease of the lungs. Notice I did not say pneumonopathy, although you will hear people say it, and if you say it, I'll know what you mean. But pneumonopathy is how I've been taught to pronounce that word. And that's any disease of the lungs. So that's an umbrella statement that means something's up with the lungs. Nothing specific, but there's a pathology. Pneumonitis is a little bit more specific. That's inflammation of the lungs. A pneumonectomy is pretty darn specific. That's excision of the lung or part of a lung. So you may or may not know this, but your lungs have various lobes. On your left side, you have 3 lobes. On the right side, on the right side, you have 3 lobes. On the left side, you have 2 lobes. And if they are able to isolate cancer to one of those lobes, many times they can remove just that lobe and leave the rest of the lungs intact. So that's what we call a, perfect world scenario if you have to have anything removed. Either way, if a lung is removed, it is referred to as a pneumonectomy. Spiro. This means to breathe, this combining form. As in spirometer. Notice I didn't, once again, I wanted to say spirometer. It's a spirometer. It's an instrument for measuring lung capacity. And when we do that, of course, we add the Y on the end, and now it's a procedure or a protocol or a process, meaning spirometry. And this is the process of measuring the breathing capacity of the lungs. This is a test we do in the clinical setting. What you're seeing here is an example of kind of an old school spirometry. Or spirometer, rather. That's probably from the late 90s, early 2000s. They take on various forms. I have done this test with patients, or performed this test on patients, I don't even know, hundreds of times at least. I could give you a lot of detail about it, but what I really will tell you is that we have you take a deep breath, you blow as hard as you can for 6 seconds, 3 times in a row, and we collect the data. There's certain things that we want to know, like your vital lung capacity, how many liters of air can you get in your lungs, and that gives us information about emphysema and lung disease. But it also gives us really good information about how well your body is processing that oxygen, how quickly that you can inhale that. Can you get it all in within 1 second, or is there a variance in time? And there's 15 or 16 really important values that you'll see in a spirometry that are really important to the doctor to determine the lung health of the particular patient. So if you have a lower respiratory tract infection and difficulty breathing, we're going to do a spirometry on you. And if you're really sick, you're not going to be happy about it because we're going to make you take deep breaths and blow as hard as you can. Probably going to cause you to cough. And you can imagine. Oxy. This is our combining form for oxygen. So we had some suffixes, right, that stood for oxygen, but we also have a combining form and more than one. Because earlier I showed you hypoxemia, and we looked at oxo then, right? Well, oxe is also a combining form, so be aware of that. And we describe it here as an oximeter, so that's how we're using it. Oximeter is an instrument for measuring the oxygen saturation of the blood, also known as a pulse oximeter, or you heard me earlier refer to a pulse ox. You've seen them. You can buy them in CVS. They're very common now. 20 years ago, they were kind of a big deal, but not so much anymore. And you can get one for 20 bucks if you want it. This will measure the amount of oxygen in the blood via an algorithm very quickly. An infrared light goes through the capillary beds on the finger where this is attached, and it looks at the density of blood, and from that, it builds off of an algorithm a percentage of what oxygen you have in your bloodstream. They're fairly accurate within a few points. For a quick and dirty read on a patient, to find out if they're hypoxemic or have any sort of oxygen deficiencies, this is a quick and dirty way of getting that answer. It's not what you would want to do if you need an exact answer. And it also measures the pulse, and so your heartbeats per minute. And the pulse is important relative to oxygen saturation for various reasons that I won't get into right now. But that's your pulse ox right there, or officially the oximeter. Arterial blood gas. ABG is how we abbreviate this. This is a measurement of the content of oxygen and carbon dioxide in arterial blood. Those of you who are interested in phlebotomy will never do this test unless you get a special license. Usually only respiratory therapists can perform an ABG, And the reason for that is you're drawing blood off of an artery, which is a more dangerous prospect than drawing off a vein. So a phlebotomist is trained only to pull venous blood from a patient, never arterial blood. Like I said, in California, this requires a special license. It's kind of a big deal. And if you puncture an artery and you don't know how to deal with it, you can cause great harm and put that patient in great danger. So you definitely don't want someone performing this who's not licensed. So phlebotomists, you'll be drawing blood out of veins only. And if you go on to be a respiratory therapist or other form of working in pulmonology somewhere, you may get the license to do an ABG. But as a phlebotomist, you will not be doing ABGs. And be thankful. It's, can be dicey at times doing ABGs. Okay, so as you can see the illustration in the middle of the woman shrieking down here. Ooh, don't make me do another ABG. I'm scared. Hemo is a combining form for blood. We're going to introduce it today. We'll talk about it much more in the next chapter because we'll be talking about the cardiovascular system. A hemothorax is blood in the chest cavity. Hemoptysis is the spitting up of blood. And hemophobia is a fear of blood, which some people have. I know I have family members who do not want to see blood for any reason, their own or anyone else's. And they have that certain reaction that we'll talk about in the next chapter when they do see it. And sometimes loss of consciousness is the result. So we want to be very careful with people who say they have hemophobia. You have to believe them. I'll share a story with you in the next chapter about someone who didn't exactly have hemophobia, but gave me an interesting experience all the same. Okay, now we're going to talk about the pleura. Its combining form is pleuro. You see here upper left. The pleura is a double folded membrane enclosing each lung. So simplistically speaking, this is mucosal tissue, so it secretes a type of mucus. It lines the outside of the lungs, and in one continuous membrane, it folds back and lines the inside of the thoracic cavity as well, which leaves a very small space you see illustrated here called the pleural space. Within the pleural space, you have mucus. What this does is it produces mucus and it allows you to expand and contract your lungs. And with the chest movement, and of course the ribs expanding, think it coming off a hard bike ride or a treadmill and you're trying to catch your breath and you're breathing heavily. Well, if you didn't have something there to give that surface some lubrication, you would be rubbing your lung tissue right up against the bones on the inside of your rib cage, which would be very sore and make it hard to breathe. The pleura provides this lubricating surface and two lubricating surfaces against each other. So as the lungs expand and contract, they do not build up any friction. Of course, there's a space there, and pathologies are always lurking in the corners, right? And sometimes they look for tiny spaces. And a pleural effusion would be one of those. This is abnormal presence of fluid in the pleural cavity. So this is inside the chest. Now you're inside where the lung fields are located. Now you're inside the pleural cavity. And in between those layers, as you saw in the previous picture, there's a tiny space. Well, sometimes fluid can get in the lungs for whatever reason. Interstitial fluid, let's say, could be the result of infection, could be the result of blunt force trauma to the chest that causes bleeding in the pleural space. Gravity pulls that blood to the bottom of the lung fields, as you can see illustrated in the picture. The more the fluid accumulates, the more it pushes the lung up, and it actually reduces the lung size. So this is going to look like congestive heart failure. This is going to be symptomatically, it's going to sound a lot like a heart attack because they're going to have difficulty breathing, short of breath, can't walk very far without being exhausted, all these types of things. And what it is it's displacement of the lung fields due to fluid being in the cavity. Now, it has to be removed. That fluid can't stay in there. It's not conducive with survival. So thoracentesis is a procedure that's done. I've assisted in this a couple times. Thoraco is the combining form for chest. So I know you've seen it as a suffix. Now you see it as a combining form. Thoracentesis is a surgical puncture of the chest to remove fluid. So in this case, and I've seen it, as I said, I've participated and assisted a few times in this procedure. They go in through the bottom of the lung fields. They'll go between a couple of ribs. They'll get just inside that pleural cavity. They'll use a syringe to get the suction started. And then that jar, by the way, that you see next to the patient would not be sitting there. It would be on the floor because as that fluid drains out, they're going to use gravity to pull it down into the jar and collect it that way. I've seen patients who've had to have this procedure done multiple times a day to keep the fluid off the lungs until the doctors could figure out why there was fluid on the lungs. And as an RT, we go in and take frequent chest x-rays of people who are in this procedure. Sometimes as they're doing the procedure, we'll come in and do a chest x-ray at the doctor's request. They'll want to see if that lung field is returning to its normal size or not. Of course, it gets complicated if it doesn't, because then lack of oxygen. Pneumothorax is based in the combining form pneumo, which means air or lung. And a pneumothorax is simply the same concept, but instead of fluid in the lungs, which you'll see at the bases, here it's air in the chest cavity that's not supposed to be there. Not air inside the lung, but inside that pleural lining that causes, once again, that lung field to be reduced in size and reduces the amount of oxygen the person can get. And so same sort of thing. They can use a type of puncture to remove that air, and there are different ways of causing it or fixing it. And some of the causes are blunt force trauma to the chest, may cause bleeding, but it might also induce air into that pleural cavity. And once again, pneumothorax is the same as as I was showing you before. Instead of having fluid in here, now we have air. And the one thing that we see in radiology is that the lung will be reduced in size from the lateral aspect moving towards the medial. If we look at and we see that the lung fields are reduced, but they're the same width, and the corners of the costophrenic angles at the bottom of the lungs are rounded, then we know that we have fluid in there. And if we see something that looks more like what you see in this drawing, we know that there's air in there, and we know it's a pneumothorax. Pneumothorax can lead to a complete collapsed lung. So atello is a combining form that means incomplete or imperfect, and it refers directly in this slide to atelectasis, which is a completely collapsed lung. Now we have no exchange of O2 and CO2. It could be an obstruction, excessive secretions in the pleural cavity, pressure on the lung from a tumor, pneumothorax, hemothorax. You could have blood in that area. All kinds of reasons that this atelectasis might happen. And it's treated by respiratory therapists initially, and then sometimes a pulmonologist gets involved if it becomes more serious. Many cases of atelectasis can be treated pretty quickly, actually. For someone who's had hip surgery, let's say they can't get up and get around, and they've been in bed and they haven't used their lungs well over the several weeks, atelectasis can happen spontaneously. This is the idea that you're not using your lung fields, you're not breathing heavily while you're lying in this bed, you might be on oxygen, and the lungs might just sort of start to collapse. And it does happen, and it's called atelectasis. Can be treated, and if you're in a hospital setting, they're going to be monitoring you for this, so they'll know it if it's happening, hopefully. Pyo, combining form for pus. So pyothorax is pus in the chest cavity. Empemia is another word for it, or empyema. And same concept as we discussed. So it's not blood, it's not water, it's pus that's in the chest cavity, and it's having the same effect. It's preventing the lungs from functioning correctly. Okay, I'm right at 13 minutes. There's only a couple slides left, but I'm not going to be able to squeeze them in here without being insanely rapid. So I'm going to just pause it. I'll be back in a moment, and we'll give you the last couple of slides, and then we'll be done with this lecture.